All right. Hello, everyone. My name is Candace Boutel. I am with Inspire Sheboygan County, and I am very excited to introduce to you our guest today, Chad Dahl with Bellin College. He is an assistant professor. And Chad, one question that we like to ask our guests right off the bat is to tell us about your own career path and how you got to be where you are, and maybe even what you were thinking in high school that led you down this path.
All right, welcome everybody. So my career path is kind of interesting. I mean, wasn't a direct path to my career presently. In high school, my intention was to be a doctor. Really didn't have a specific kind of doctor I wanted to be. So I ended up in high school, like going into a lot of math and science courses, and eventually going to like summer camps for math and science at local universities. And eventually I ended up going to UWGB for a bachelor's in human biology, with still the intent of becoming a doctor, going to med school after my bachelor's degree. And as part of going to med school, it is required that you have some healthcare experience. And back then, when I was in college, it was a little harder to kind of get that healthcare experience. So I ended up going to one of the local hospitals and just applying for a job, just looking for any career in the healthcare field at all. So I didn't have any idea at all what I was really looking for. And they ended up hooking me up with a job in the radiology department as an assistant to the radiologic technologist there. So my job was to get patients for them, change patients, change the room over, clean the room, just kind of get some of their everyday duties kind of like under control so they could focus on the patient and kind of get that patient workflow through a little bit faster. So I ended up working there my junior year. I started working there. So I worked there a full year, and then it became my senior year of college, and really kind of looking into like, all right, now I need to decide where I want to go after I graduate. So that's coming up. So I started applying to some med schools, taking the MCAT, things like that. I'm still working at the hospital in radiology. And during that whole year prior to my senior year, I was gaining more and more knowledge of radiologic science. Prior to that, I had no idea what that career was. I had an x-ray as a kid breaking bones, but I always thought a nurse took the x-rays. I had no idea it was a separate career. So working in that field, yeah, for that entire year, I definitely gained more experience, more knowledge. The technologist kind of took me underneath their wing, kind of showed me the ins and outs of the career, kind of showing me how to set up exams, all the radiation protection behind that career. And I just kind of fell into like, a good environment. I liked the people I work with. They liked me, and they approached me and said that, we really like you as an employee. Would you ever consider going to X-ray technology school? It's not something, again, I didn't know there was even schools for it. I didn't even know, like I'm in Green Bay right now. Bellin College, where I teach, is actually where I graduated from X-ray school. I didn't know that there was an X-ray school in Green Bay at the time, even though it was at the hospital right next door from where I was working. So they said, hey, if you would go to X-ray school, we'll pay for all of your schooling. You just have to commit to working at our institution for 2 years after graduation. So I had a decision to make whether to continue on the path of med school or go this other direction, still in the healthcare field, still dealing with patients on an everyday basis, but a different pathway. And I chose to go the pathway of X-ray technology just because I had a good idea. I felt good in that career based off of my exposure with that career. So I went that pathway. And at the time when I went, it was just a certificate program. So it was a 2-year program in X-ray technology when I went. And I completed that 2 years, worked in X-ray in the ER primarily because I worked a third shift, 12-hour night shift from 6 p.m. to 6 a.m. So we did that, or so I did that for probably like 5 or 6 years, just working that night shift. After that, I was looking for a change. And the hospital I worked at was bringing in an MRI machine into the hospital. Prior to that, their MRI machine was outside the hospital. So they were instituting an MRI department inside the hospital. They were going to need MRI technologists to kind of fill those roles. And traditionally, X-ray technologists are trained in MRI, like on the job training. So I kind of like fell into that role as well, kind of, said I would be interested in it. They said, okay, we'll take you on. They trained me on the job in MRI technology. And I started working in their MRI department for, another 5 or 6 years. And then after that, I switched hospitals. It just made sense based off of the hours and kind of like my family and social life. So I switched hospitals just to kind of fit my life a little bit better. And after that, Bellin Health is where I worked at for MRI, and they're closely connected with Bellin College. So Bellin College was starting a bachelor's degree radiologic program that included MRI as part of their training. So they were looking for an MRI instructor and reached out to me to be an MRI instructor at Bellin College. And then from there, I took on further roles of teaching radiologic physics here at Bellin College. For some of the students, I teach a high school class for Introduction to Healthcare, and then also like healthcare economics, healthcare leadership. So that's my overall path. Again, just kind of like fell into multiple different situations, right place at the right time, and keeping my options open so that I didn't leave any doors closed, and just like going one direction. So.
Oh, that's really great. And we always love to hear those stories. There's several things that stood out to me about what you said. So you started out with that radiology assistant. Does that job still exist? And does it just require a high school degree? What requirements to get into that type of role today?
So that job exists in a few places. It exists back when I was in school, or when I got that job, because there was a shortage of X-ray technologists in the work environment. So it was a way to kind of help the X-ray techs with that workflow shortage. Right now, they are present in a few institutions. It just depends on how busy that place is. But I was working there as a college student, but some of my fellow employees that were also X-ray technologist assistants were high school students. So there's no real requirements, just that you had an interest in healthcare and you showed up to work and things like that. So there's no overall requirements that I know of, but a lot of them do like that you have some patient care experience kind of to begin with, or maybe like a CNA certification to kind of help with that.
Yeah, definitely. That's kind of what came into my mind was that CNA, that maybe that was a similar level, right, of
Yes,
practice.
exactly.
And then I'm hearing, the X-ray tech school, that was a 2-year program. So if a student were to go directly into that program, is that an associate's degree? You mentioned that it was a certificate. What might that look like for a student who knew right away they wanted to go to X-ray tech school?
Sure. So there's different pathways right now. So there is that 2-year program that's an associate's degree offered at a lot of technical colleges. So it's basically you're going to want to have a lot of science background to get into that program. It's going to be very competitive, just getting into there, because they only offer so many students. And our program as well, just based off of, we have to get into the clinic setting for experience, and there's only so many clinics available. So we can only accept so many students per year to get into those clinics. Our program here at Bellin College is a bachelor's degree program, so it's a 4-year program presently, but next fall we are switching to a 3-year bachelor's degree program here at Bellin College. So you're going to get your bachelor's degree in 3 years. It's going to be a year-round program, so you will be committing to going to school during the summer, which will be primarily a lot of clinical hours in the summer, but you get done in a shorter amount of time, 1 year, 1 year quicker, out in the job force, making money 1 year sooner. So. And a lot of places are looking for more that bachelor degree level as an employee to kind of come on. So some hospitals or institutions will, if you come in with an associate's degree, have that expectation that maybe you move on to get your bachelor's degree at some point in your career.
That's really good advice. And ironically, we just heard that same thing. We were talking with a registered nurse earlier, and she was saying that same thing about the nursing program as well, that, you can get your associates and you take that exact same exam, but then the expectation maybe later on is that you pursue it. Would it be more likely that if somebody did come out and get hired with their associate's degree, that the organization or the employer might help pay for that bachelor's, kind of as what happened with you?
Yeah, so a lot of institutions do offer some reimbursement for tuition. They have different degrees of reimbursement for sure. But if there is a big push in that organization to go towards bachelor's degree, a lot of them do pay a good percentage of it just to have that incentive for you to go back, because they know it's a lot of work to work full time or even part time and try to go back to school and get that degree. So getting it when you're younger sometimes is easier before getting into the work environment and then trying to do that dual duty of going to school and working and possibly having a family as well.
Yeah, that definitely takes a lot of organization and
Yeah.
Resilient. So I'm interested to know, we were talking earlier that, it's a little bit of Bellin College is a little bit smaller school. What should students do? Like, what does the application process look like? What should they do to make themselves stand out to get into the different programs? Why don't you tell us a little bit about that?
Sure. So our programs, again, we only select, depends on which program, but it's a smaller number, again, because of the number of clinical sites that are available to us. But it's going to be like in radiology, it's 15 students that we accept per year. So we may get, so many applicants, but we can only accept 15 students. And to make yourself stand out to be selected, again, good grades is important, but it's not the only thing we look at. Currently, we don't look at that ACT score as a qualification anymore. So we look at it as a, kind of measurement of how well you've done in school, but it's definitely not going to eliminate you from getting selected. We're looking at the kind of well-rounded student aspect, kind of what activities have you participated in while in high school? What kind of volunteer opportunities did you have? What kind of medical background did you have as well? Like that CNA program is a huge benefit if you want to get into the healthcare field, is having that in high school and having that experience with working with patients. That's going to definitely make you stand out, because we now know that you have experience with patients and you know what it's like to work with patients. So when you get into that clinical experience, you're not going to have that awkward kind of transition of, I've never talked to anybody before like this. It's going to make you more successful in the program. So that's definitely going to make you stand out. And just the interest in job shadows are definitely important, because we want to make sure that you truly know what you're getting into, because we only have 15 spots. We don't want to kind of like accept somebody into that program and then have them drop out their first semester because they really didn't know what the program was or what the career was. So we want to really make sure that you have an idea what that career is.
Yeah, those are all great activities to be involved in. Are you finding that things are starting to open up as far as students getting opportunities to go out and actually shadow? Can you think of is that something you're considering for like the next group of students that you're bringing in, that over the last, year, they haven't really been able to do any shadowing? Do you have any suggestions around that?
Sure. So it is definitely difficult. I've been part of job shadows, setting it up as part of my high school program, or my high school class. We did job shadows as part of that class. Now they were all shut down due to the pandemic. So some of the ways around it, definitely if you do have a personal connection with somebody that works in the healthcare setting, family member, friend, anything like that, that's definitely going to possibly get you in the door, because they're not maybe opening it out to the public, but maybe that personal connection can kind of get you that relationship to get in there for a brief visit. Otherwise, if you are truly interested, definitely reach out to your institution that you're looking to apply to. Like for us, if you couldn't get in for a job shadow, we'll bring you on campus and let you shadow our clinical or like our simulation environment that we have with our students, maybe shadow our classroom experience as well, so that you have an idea kind of like what the classroom or education side is, and we'll let you get some hands-on kind of like work here on campus so that you have experience working with the equipment or actually seeing what the equipment is. So doing something like that. We do have summer camps that are available as well. That's definitely another thing to kind of look into for some institutions. So there's definitely like nursing summer camps, medical imaging summer camps that you can kind of get into, that will give you that job shadow kind of experience to kind of like work around. Otherwise, watching videos like this definitely is a great asset. Going on YouTube, looking up videos for that specific career definitely would help you kind of get an idea if you can't get in for a job shadow. Because watching Grey's Anatomy is definitely not the way to go for things like that.
We've heard that the comparison maybe is not ideal with some of those medical shows. Oh my goodness. Those are great suggestions, though. I didn't know that a student could, request with the school that they're thinking of applying to. That is such a great idea. I mean, what better way to get insight into what that schooling would be like than to actually go there and talk with other students and see the facilities. That's a great idea. Okay, so I'd love to talk a little bit more about just this field in general. So the radiologic technology, and you mentioned that you had a few pictures. So if you just want to tell us like what somebody interested in this field might encounter, what their day-to-day would be like. I think that's something we're always looking to find out about specific career fields.
Do you want me to show pictures at the same time or just kind of talk
Sure.
first and then.
If it helps, whichever makes more sense to you, if it helps, if you're going to be referencing one of the machines and it might be great to have that visual. So I think you should be able to go ahead and share your screen if you need to.
Yeah, I think it's an option. So yeah, MRI, what I'm kind of here for today is definitely a branch of radiology. So usually MRI technologists go to radiologic technology school and then get either on the job training, or they go off for a extended like training course somewhere else, or maybe like a week-long program or something to kind of get the background of the physics behind MRI, just because it is a little bit different than X-ray, just the way we acquire the images or basically take our pictures. So it's a little bit different. I'll share kind of my screen to kind of show like a few different things about MRI and kind of like talk through it as well. Hopefully you can kind of see that.
Yes,
So that's basically it's showing an MRI kind of environments. That's one of the MRI suites at Bellin Health. So they're looking quite different than the older kind of MRI suites. It is an medical imaging machine, meaning that we're taking medical images of a person's body. So MRIs do that with utilizing a large magnet, which is the large donut that patients go inside to take those pictures. And there is no radiation involved with MRI. So X-rays use radiation, CAT scan uses radiation, mammography uses radiation, but MRI does not. Again, we use that large magnet to use our pictures. And then we also basically send radio frequencies into the body, and then those radio frequencies are absorbed by the body, and then the body gives off amount of frequency as well after a certain period of time. And we listen for those frequencies coming back from the body, and that's going to create our pictures for us. So depending on what type of tissue it is, it's going to have different components or different frequencies, and they're going to create different images based off of the types of tissues that are in our machine at that moment of time. So that's basically the very rough explanation of MRI, none of the physics behind it. But again, we're using large magnets and radio frequencies to kind of create our pictures. These are some of the devices that we use to acquire our pictures. So if you've ever had an MRI, and more people are having it because it's becoming, more and more common, especially if you're young and in sports, sports injuries are a very common reason why we take pictures of people's body. But these are all the devices that we put around the body part that we're taking pictures of. So the patient is laying on the table and we're putting their body part in one of these devices. And this is basically an antenna that is picking up that signal, that frequency coming from the body. So it has to be around the body part that we're taking pictures of. So if you're having your head scanned, there's going to be like a helmet that kind of goes over your head during the pictures, and your head's going to be inside the machine. If we're scanning your foot, there's going to be like a boot that goes over your foot to take those pictures, and your foot's going to be inside your machine. So your head's going to be outside the machine. So it just depends on what body part we're taking pictures of, what kind of body device that we're going to use, and where you are going to be positioned on the table or in or out of the machine or not. So again, various different devices depending on what kind of MRI that we're doing, because we can image a lot of different body parts in MRI. A big portion of it is neural exams. So we take pictures of the brain. We take pictures of the spine and the spinal cord. So that's a large portion of our day, is doing exams related to the brain and spine, because there's a lot of pathology or diseases related to these areas, and it does impact people's lives greatly. So that's a big portion of it. Another portion is orthopedic work. So the first picture I pulled up, or this one in the middle, is a knee image. So we were doing a lot of images of the knee, looking for, ACL tears, meniscus tears due to injuries. The image over on the lower left-hand side is a shoulder exam. And the other image on the right is an elbow exam. So we're doing a lot of different orthopedic exams as well. So I would say neurology and orthopedics are like the two major components in MRI, where you're going to spend a lot of time imaging those areas. Other areas is like this one. This is an abdomen picture. So this is looking at a person from the front, and we can see their liver on one side, their spleen, the kidneys in the middle. We can see their spine and their lungs throughout their body. So we do a lot of abdominal imaging, usually as a follow-up from an ultrasound or CAT scan, just to help with that further diagnosis of that condition or pathology that was present in that person. This image here that I just popped up is a vascular study. So we do a lot of images of vessels inside the body. So this is actually the arteries inside your brain that you're seeing right there. So we do a lot of stroke imaging. We're looking for those blood vessels that are either clogged with a clot or maybe blocked off due to some buildup inside there, plaque buildup inside there. We're also looking for any possible bleeds from those vessels as well. So that's an arterial study, and we can take pictures of any artery inside the body. And then finally, we also do OB work. So that's actually a picture of a baby. So you can see the little face, the little eyes on there. So we do that as well as a safe alternative. Instead of doing an X-ray or CT where it involves radiation, you can do ultrasound, of course, but we can also do MRI for some further diagnosis based on that ultrasound. Because we're not using radiation, it's a safer mechanism to kind of do for that pregnant condition. So those are some of the images that we definitely do. But again, neurology and ortho are definitely a large component of what we're going to be doing in MRI. Just going to go through some of these things. MRI safety is big in our environment because we're not using radiation. We have to use that large magnet. And anytime that we deal with a large magnet, there are things like metals that have to be of concern. So those are some pictures of metal detectors, just like you're going through an airport. We kind of go through the same process of checking people to make sure that they're safe to get into the room so that there's no safety events where large objects are attracted to the magnet. And we're basically the gatekeepers, making sure nothing unsafe gets into the room. Because these are some incidents where devices got into the room that shouldn't be there. So because it's a large magnet and our magnet's always on, we don't turn it off because it's very expensive to get it back going. It attracts metal objects. Like this is a wheelchair that was brought into the room that is stuck to the magnet. This is a large patient bed that was brought into the room that shouldn't have been. And then here's an oxygen tank that's stuck inside the magnet. Again, acts like a missile. Because it's so strong of a magnet, it's going to violently pull it out of your hand and bring it into the magnet as fast as possible. So again, we do have some safety concerns. It's not dealing with radiation safety, but it's dealing with safety and that magnetic environment that we work in. So those are definitely some of our concerns. With MRI, this is what the patient kind of sees. So patient's laying down on the table and we're sliding them into a tunnel. So a lot of it is communicating with the patients, dealing with the patient's concerns. We deal with a lot of claustrophobia in MRI because patients sometimes have past experiences that they don't like small spaces and confinement. Sometimes it's just the anxiety of the end test results, what we're going to find inside there. So as MRI, this is typically what patients describe to us that we're, burying them alive. And we want to get that out of their head. And we have to kind of like explain the exam as best as possible before we get them into the room so they have a better understanding what's going to be involved. So a large portion of our day is talking to patients and making sure that they are aware of what the test is going to be and answering any of their questions before we get in there. Because once they have that idea of that coffin, it's hard to get it out of their head and hard to get them through the test after that fact. So a lot of anxiety in MRI, and we just try to work around that. I'm just going to go through some of these. So we have multiple different ways that we can kind of get through that anxiety. So like I said, this is Bellen's room. So it's helped to make a more calming environment. We have moving pictures, the lighting changes to any color the patient would like to make it more inviting. We also do like other things like a cloth or eye mask to help kind of like take away that visual of the machine being right over the top of them or being confined. So a lot of different things, but a big portion of it is communication, just in that constant communication with patients to make sure that that patient knows that we're still there and that we're still providing care for them. Talked about education a little bit already, but the work atmosphere can be quite different in MRI. So you can work in a hospital setting. So this is a traditional room like a hospital would be or a clinic. So it's going to depend on what kind of patients that you see. So in a hospital setting, you are going to see outpatients and you're going to see patients that are inpatients inside the hospital with more severe conditions. So a little bit different there. And then we also have mobile units that drive around to rural areas that don't have access to MRI. So we bring the MRI unit to them. That's the lower picture there. So it's in a large semi-trailer and the MRI unit's in the back of that. And we still, have access to an MRI. It's just more confining. So claustrophobia is typically more of a concern in a mobile unit just because the room itself is smaller and you can't see through the machine like you can on the other rooms. So that is primarily the pictures that I have for you for my like day-to-day kind of job. Like I said, a lot of it is educating the patients, communicating with them, and then making sure that they're aware of what's going to go on and answering all their questions before we even start.
Well, that was really helpful. The images are really great to see the differences and the things that you're dealing with. Is it a very physical job? Like, are you doing a lot of, do you need to help the patient into the machine and adjust them and things like that?
There is a good physical component. Again, everybody is coming in with a different aspect of their physical capabilities. So some patients walk in, lay on the table themselves. Some patients, you do have to assist them. Again, we can't bring metal into the environment. So we have to kind of like take away those walkers. We have to take away canes and wheelchairs. We have special MRI wheelchairs that we can use, but a lot of it is getting that patient to the table and then making sure that they're comfortable on the table. So there is some lifting in patients. Some of it is sliding the patients from their bed, because we can't bring their bed into the room, to our bed. So we do have to slide patients sometimes. So that is a little physical component, but typically we like to have more than one person kind of on the job at the time so that we're not really struggling and hurting ourselves while moving patients.
Yeah, and that actually leads into one of the other questions I had about your day to day. So, what types of people would you interact with on a day to day basis? Clearly, the patient, but
Yeah.
what other providers would be helping anytime somebody was getting this testing done?
Sure. So you're definitely working with your fellow coworkers. So depending on what kind of environment you're working with, you may work with like one MRI technologist, or you may work with like 10 MRI technologists in that same environment. We're also working with our front desk staff who like admits our patients, screens our patients for us, sets up the appointments. So you're definitely working with them on a day-to-day basis as you work through your schedule, because we definitely have to communicate with them how we're running on the day. So healthcare facilities, there's a good tendency that we run behind just based on the patients. We don't want to rush patients through. So a lot of patients sometimes need more time. So we do run a little bit behind. So we do have to communicate that with our front desk staff. We do work with radiologists a lot, which are the medical doctors that read the MRI images. So we have to be in communication with them, basically showing them the pictures, asking them any questions if they want further imaging based off of what we found on those images, and just kind of doing quality checks, making sure that everything was covered before we send the patient on the way. We don't want to have the patient leave and then have to come back because the doctor wanted further imaging. So we're definitely in communication with the radiologist at the time. And then also the ordering providers, sometimes we do talk to just to clarify orders. So sometimes an order may not be the correct order for the patient or the best exam for the patient. So sometimes we do have to communicate with that ordering provider as well. We also work very closely with like the nursing staff at the hospitals, because a lot of times they're the caregiver for the patient that they're bringing over to the MRI department. They're going to have that background knowledge of the patient's conditions, history, and we have to kind of like work with them to kind of get some of those background information. And they come over and just monitor the patient as they're in the MRI machine as well. If a patient does have some like heart monitors on or oxygen or anything like that, they're going to be present with us as well.
Yeah, so it really takes a team to make all of this
Yes.
happen each time.
Yeah.
And is it likely, or does this happen often, where somebody's doing, the X-ray tech role or some of those other roles that we've discussed today? Do they often go on to become, continue schooling to become a radiologist, or what are some other areas of growth for someone that would go into this field?
Sure. Usually we don't transition to become a radiologist just because it's a different pathway. It would take you to go to med school and then become trained in a radiologist role. So that's very long. I mean, it definitely can be done, but it's usually not the path for us. Some of our coworkers have gone on to be physician's assistants, so PAs. So that's definitely a good way to kind of like advance, just because with your background in medical imaging, it is going to be highly sought after. So it's going to definitely make you stand out in applying for PA school, because you have that patient care, plus you have that medical imaging background that a PA is going to need when ordering their tests for their patients and diagnostics. So that's definitely going to help you. Also, administration is one. So going for maybe like a healthcare management role, whether it be a team facilitator, director, anything like that is definitely advancement opportunities. Education, so like myself, advancing into the education realm is another way to kind of advance within X-ray or medical imaging. But with that base education of radiologic technology, like with MRI, there's definitely multiple different avenues to kind of expand. So I started as an X-ray tech, advanced into MRI. I could have gone into CAT scan. That's another kind of avenue. You can go into mammography based off of your X-ray experience. So that is another way to kind of advance, as well as just that cross training or advanced training in the radiology field as well.
That kind of brings up another question I had when you were talking about that you do a lot of neuro, a lot of orthopedic. How is it decided what type of imaging is going to be best for that injury or that disease?
Imaging altogether. Yeah,
Yeah, like
X-ray,
how do you
MRI.
decide an MRI versus a CAT scan?
Sure. So that's a big thing. Again, the ordering provider is going to be the one ordering the specific test. But as a professional in the X-ray or radiology realm, they definitely can reach out to us to kind of figure out which test is best, or they could ask the radiologist. Since the radiologist oversees or reads X-rays, MRIs, CTs, and mammos, they're going to have a really good idea too, which test would be best. But a lot of it has to come down to our limitations in the different imaging modalities. Like X-ray is very good at looking at bones and some soft tissues. CT is very good at neural work, also very good at like abdominal and chest work for lungs and stuff like that. MRI, we're very good at neural work because we can see great soft tissue kind of like pictures. So we can see all the soft tissue of the brain. We can see the spinal cord, where a lot of other images like CT, X-ray don't really see it as well. We can see the individual nerves. So that's one way we're pretty good. And we see like tendons, ligaments, and muscles very well. So MRI's just that soft tissue kind of focus really helps us in those realms. And ultrasound, depending on what they're looking for, limitation wise, it's just depending on the again what they're looking for. Ultrasound is great at many different things, but they also have some limitations. So it's just trying to figure out what pathology or injury you're looking at, and then just trying to decide what might be best. We definitely couple or partner with imaging. So a lot of patients start in CAT scan and then they may end up in MRI, or they may start in ultrasound and then they may end up in CAT scan. And you may start there to get your base diagnosis, and then a further diagnosis based off of what you found may be required as well. So hopefully that answered the question.
It does, yeah. I mean, it's. I suppose when you're trying to, eliminate or dig deeper into what it really is, it might take multiple tests
Yes.
or different, discussions. So we're kind of getting to the spot where we start to wrap up. So students, if you have any questions, please go ahead and put those in the chat. But to wrap up, what skills would you say are really important to be successful in this field?
Initiative is really important, because when you get into a healthcare like education environment or going into healthcare fields, you have to want to get out there and get that experience with that patient. So if you're the kind of person that stands back and just watches, you're not getting that hands-on experience that you need to have a really solid background in that field. So we're looking for students or individuals that have that initiative, that really want to step up right away, jump right in, and get their hands dirty with everything that we have in the healthcare environment, so that they get that hands-on experience that is really necessary with working on patients. And I guess you do have that strong science background, so we do require that, because a lot of our images are anatomy based or anatomy heavy. So you do have to have a strong history in anatomy or biology just to have that base. So you know what you're looking at, so that you know that you've covered the correct area for diagnostics. Communication is a huge key. You're talking with people every day, and that person has to believe that you really care for them. So you do have to have that strong communication and empathy for people, so that that patient feels cared for, and that you're not just there to collect a paycheck. So they have to know that you're really in there for them, and you're focused on them at the moment, and you're not worried about something else throughout the day. So I would say initiative and communication are probably the really strong things that we need in the healthcare field. And then also a lot of the other or knowledge based kind of like skills as well. But those would be some good ones.
Yeah, that is a great list. And students, what's really nice about that is all of those skills can be practiced. You can always
Oh, for
improve in
sure.
those skills. Yeah. So don't count yourself out if you,
No,
feel like you're an introvert or something. It's definitely something you can work on
for
and
sure.
work towards.
Yeah.
Tad, I really appreciate all the information you shared with us today, the images and your experiences. It has been very helpful for us to really get a sense of what the field of MRI technology is all about. So thank you very much.
You're very welcome. Thank you.